Hey everyone, today I want to talk to you guys about some test taking strategies for taking the CST exam and also taking some of the other predictor and mock tests that we give you guys to help you prepare for the CST exam. One of the best things that you can do to help you really understand and get over that test anxiety is know the format of the test you're taking, especially for your CST exam. Know what it consists of, know how many questions are on it, know how long you have to take that test. So for the CST exam, it's 200 questions. 175 of those questions are graded, 25 are not graded. The 25 that are not graded, those are kind of for research to see how students do on those questions, but they won't be counted towards your actual grade. You have to get 102 questions right in order to pass. The CST exam is a pass or fail test. So you have to get 102 total right in order to pass, and that's the minimum passing number. You have a total of 4 hours to take the exam, so take your time. Make sure you're reading every question. Make sure you fully understand, because you have it's 240 minutes for you to use to take that exam, and if that's more than a minute per question in order to take it. So take your time, read every answer option, break down those questions. When you read the question, you should be able to identify, okay, I know it's not A and I know it's not B, but C and D are both good choices, but we want to pick the best choice. And sometimes the CST exam gives us a couple of different choices. Both of them sound good, but which one is the best choice? So pick the best choice for that answer. If you don't understand a question, mark it and come back to it later. And then, then that way you're not wasting a whole lot of time on one question, and you can continue on the exam. And then at the end of the exam, you go back and you look at the questions that you marked to review. You can also, during that time, it is a long time. 4 hours is a long time to take a test. I know some of you have mentioned that setting for that long of a time can really be tiresome, and you get fidgety, and you can take a break during the CST exam. However, the CST exam does not stop. The time does not stop when you're taking that break, so your clock is still ticking during that time. But if you're on track and you're doing okay with your time, take a little break, set back for a couple minutes just to decompress for a minute, but then get right back into that test. But don't let the time bother you, because if the time is an issue, use the full 4 hours. Use it all. You don't have to rush through this in 2 hours. Take all the time you need to complete the test. So many of you ask what's going to be on the test, and there is no specific answer. There's no crystal ball. There's nothing that tells us, okay, we know these questions are going to be on there. We don't have access to that. What we do give you is the materials in order to be prepared for that exam and show us, what we can study, what we can review. Use the resources. Use your AST Gold Bundle book. Use the white notebook here that talks about what's in the test, what's on the test, different questions. Use those to really give yourself some practice exams as well. Knowing the topics in the test will also help relieve some of that test anxiety. It'll help you better understand what to expect on that test if you know what topics are going to be there. That being said, perioperative patient care constitutes 60% of your test. That's huge. That's a huge portion of your test. That means 105 questions come from perioperative patient care. The exam centrals on three central topics in perioperative care. Those topics are preoperative preparation, that's 29 questions, intraoperative procedures, 66 questions, postoperative procedures, 10 questions. Additional duties constitute 10% of the exam. That includes the administrative and personnel. There's 10 questions on that, and then equipment and sterilization maintenance, 10 questions. So, I know a lot of guys have struggled with sterilization. Remember, 10 questions come from that material. Really focus on hitting that perioperative patient care area, because that's 60% of the test. So that's a very big portion for us. Basic science constitutes another 29% of the test, and it's broken up into anatomy and physiology, which is 30 questions, microbiology, which is 10 questions, and then surgical pharmacology, which is 10 questions. So a lot of you guys stressed over that pharmacology, and it's only 10 questions of the test, but we do have that pharmacology review up online for you to look at as well. When it comes to preparing for the CST exam, use our one-on-one times that we're working with you guys on. Use those times to identify what it is you need. Work through your HESI remediation. Look at those links in the HESI. See what you're lacking. See what's in there that can explain the knowledge that you're lacking in that area. If you don't understand it in the HESI, break out your Fuller textbook, the surgical technology book that we use for classes. Use that to really to go hand in hand with the HESI. Then also use your AST study guide book. If you don't understand those questions, look those up in the Fuller book to get more explanation. Same time, keep yourself a notebook, and that way when we have our one-on-ones, you can write down questions in that notebook that you had throughout the week as you were studying, and ask me, hey, I really didn't understand this subject. Can you tell me where to get that information, or can you explain it to me a little bit better to help me understand that? If you guys use all these resources, I think you'll really see that some of the test anxiety that you guys have will go away, and it'll be more beneficial for you in the long run. Just remember, you have plenty of time to take this test. You have 4 hours. Use it. Read every question. Take your time. If you don't understand a question, mark it and come back to it. Don't get stressed because you don't know the answer to the question. You can always come back later and redo that question before you submit the test. As always, guys, you know that we're here for you. We want to see you guys all be successful. Myself, Ms. Durney, Dr. Delgado, we're all here to help you guys. Miss Black, Miss Lena, everybody is here to help you guys in any way we can. If you guys have any questions, reach out to me at gtrout@southerntech.edu, or you guys that have my number, or everybody that has my number can directly text me and I'll get back to you. Have a great day.